Good morning, friends. Thanks to the Times Cyber Media for giving this opportunity. I'm an orthopedic surgeon specialized in joint replacement, but COVID has wiped out all the specialities. No gynecologist, no orthopedic surgeon, no general physician. Everybody of us done 2 years of only COVID treatment. I think everybody accept this point. 2 years we have been thoroughly, the hospital owners, they have come across so many problems which have never expected, never dreamt that one cylinder of oxygen is so valuable. We have never gone to that micro level as a hospital owners. We would have never gone to that micro level of managing a single cylinder of oxygen. So that shows sometimes the healthcare which looks so vibrantly super, suddenly it fails in such a way that we are waiting for a ticket in the funeral, burial grounds are full. So such bad memories this COVID has left us. Pre-COVID and post-COVID era, these are the two things what we have to understand. It is not easy to change the health system in one day. We are in a country where our healthcare budget is less than 2% in our GDP. Even in the scenario of COVID, the central and the state governments, if they can't put more than 2 to 3% of their GDP into healthcare sector, I think whatever we talk today, it looks so unnatural. If you can think about out-of-pocket expenditure of the patients, what the patients have done in last 2 years. Every house, every family in India has spent out-of-pocket money for the management of COVID. So we don't have that healthcare insurance system in our Indian scenario, which can take care of 125 crores of population. Even if you bring Ayushman Bharat, if you bring Arogyashri schemes like what we have in Andhra Pradesh, it's just covering only the 30% of below poverty line patients. So we sitting here today, we should understand how can we give a quality health care at an affordable price to our patients? How can we see that out-of-pocket expenditure from the patients? It's not easy to tell, but it's a very difficult thing to maintain quality and bring down the cost of treatment to our patients. So I sincerely request everybody to encourage every individual patient who attends to our clinic to have a health insurance. If you can see, none of our patients who visits us, whatever you ask, they will not have a health insurance. Only 2 to 3% of them maintain health insurance. So if we can take up that health insurance as a motto, irrespective of our specialities, maybe after 20 years or 30 years, everybody will be having a reasonable amount of insurance and the sector grows well. If you want to give a quality care, I just want to bring few packages which has been fixed by Government of India. With 20,000 rupees, can you able to do a interlocking femur? But that's what the amount has been fixed for us. Seeing these payments, the insurance companies are asking us to bring down all our charges because we are doing for 20,000 interlocking in Ayushman Bharat scheme. Why don't you do it in a private case? So we are landed in a very different situation. I think we all should fight together to keep this system alive. If you don't have the preliminary level of medical facilities, I just want to bring a model what is being advocated in Andhra Pradesh. Andhra Pradesh is a small state which has been bifurcated from, before it was capital was Hyderabad, now it is Amaravati, the place where I come, that is in Guntur. 90% of our state population carries a card called Arogyashri health card, which comes under below poverty line, and everybody comes to your hospital with a health card. So you got only 10% of people who are paying out of cash. Imagine 90% credit business and 10% of cash business, the difficulty of management of hospitals. And the payments in the credit sector is not in the same day as the insurance. You get your payments minimum after 90 days to 120 days if you are lucky enough. So healthcare, managing the bigger centers, it's becoming very difficult. Entire business is running into credit basis. So with this typical situation in India, today, what have we learned after COVID? COVID has taught us so many things. We understood you are doing successfully, extraordinarily your joint replacement surgeries and your patients are happy. But suddenly when a crisis comes, your ICU is full, you don't know how to handle your ICU. Especially you are running a single speciality or some other specialties. I am telling you, I stopped my operation theatre. My operation theatres also converted into COVID wards. That was the scenario which has been happened. You have got infrastructure, but you don't have the human resources. So developing our own human resources, developing our own facilities, developing our own finances, the interest rates for the loans what we are getting, and if you calculate all that, maybe not all the businesses are so profitable, not all the businesses or the bigger business what you see in the health field are so profitable. After this COVID, definitely next 2 to 3 years is a recession. If you believe it or not, the patients coming for the preventive health care is definitely has increased. Patients are taking a good health care. At the same time, most of the families, I can say most of the families, they have spent a lot of money in COVID that they are postponing all their elective surgeries. It's a very difficult situation. I know it's a very dangerous situation too. People are scared to come to hospitals. So this is a time where we need to, all the doctors or healthcare sectors need to work together, bring down all our differences, bring down the expenses of the treatment to the patients. We should work together in these 3 years, the industry, to develop our human resources and facilities. Then only I think the healthcare will survive. Otherwise, I'm telling you today, even the Elon Musk, the most richest person in the world, has put forward that the world is going into recession for 2 to 3 years from now. So let us prepare for that recession and work hard. All the best. COVID has taught us so many good lessons. Thank you.
In the category among Best Single Speciality Hospital Orthopaedics Guntur AP, the award goes to BMR Hospital. Dr. Reddy, requesting you to please join us on stage to receive the award.
Good afternoon. How are you feeling after getting this award?
They appreciate the Times Cyber Awards. The jury, the way they selected the people, you maintain the quality and getting people from all over India in various branches. The hard work you have done to get back to so many people, I really appreciate it, and I'm feeling proud that you have selected a orthopedic surgeon from South India, that too from Guntur, and you give the best orthopedic surgeon. I think this is the happiest moment, and this will give us so much energy to keep up the good work and win more awards. Thank you.